All right, welcome back. We are continuing with our session on ethics and legal issues in occupational health, and we had looked at these various regulations and standards that different industries follow and aim at improving, promoting, and protecting the health of workers in different workplaces. So, we are going to continue with the dignity and human rights of workers in different workplaces, like promised. So all these we had looked at in the first session. So up next is dignity and human rights of workers. So the impact of so when we talk about dignity, we look at that feeling of being worthy, that self worthiness, that self esteem in oneself, that you're important. And in this case, in occupational health, everyone wants to feel important in their workplace. So whenever that is compromised, then there is an effect on someone's dignity. So the impact of occupational health on dignity of workers is that we have physical impacts, which include injuries and diseases that cause pain, disability, impairment, or death of workers. Then sometimes there can be an impact on the mental dignity of this person, whereby workers face anxiety, depression, and post-traumatic stress disorder, which can arise from these injuries that are caused due to their work or that arise from their workplaces. So whenever there is this injury, even after recovering from it, you can always have those flashbacks, those memories, which we are calling the post traumatic stress disorder. But also, there can be social impacts of this occupational health, whereby these occupational health problems affect workers' relationships with their families, friends, or colleagues. So sometimes you might be held up by your work and you don't get time for your family, or sometimes you might get ill and you cannot fend for your family. So all these will be impacts on your dignity. So the influence of workers' dignity and autonomy and participation has been assessed here, and we see that occupational health affects workers' self respect, self worth, and self esteem. And when it does so, it inflicts on their dignity. Like we say, dignity is that feeling of self respect, that feeling of self worth, or someone's importance in the workplace. Then also, occupational health affects workers' ability to make choices, control their work conditions, and pursue their goals. So, whenever there is no avenue for someone to make uh, decisions or participate in decision making in a workplace, then their autonomy is affected. But also, participation in decision making, in collective action, or social dialogue can be affected by occupational health. So all these influences of occupational health on those different aspects of workers' lives, the dignity, the autonomy, and participation. So the principles of dignity and human rights are based on equality, non-discrimination, respect, participation, accountability, and justice for all the workers, regardless of their status, their identity, their background, or their condition. So we expect someone to be treated with dignity or that respect, irrespective of where they come from, their identity, their economic status, and they should be able to participate in decision making at the workplace, especially that affects their health, should not be discriminated against based on their gender, their skin color. So all that will effectively put in place dignity, or the person and the worker will be able to feel self-worthy and respected in the workplace, which is very essential in productivity and competitiveness of any business or organization. So the standards of dignity and human rights in the workplace are derived from international and national instruments, which we had looked at in our first session of these ethics and legal issues in occupational health. And these organizations that put in place such standards include the International Labour Organization, the UN, which has put in place treaties and declarations that protect the welfare and well-being of workers in their workplaces. The national laws like the South Sudan Labour Act, all these provide the legal and normative frameworks for regulating and monitoring work-related matters such as how much someone is supposed to earn and what shouldn't be earned, the hours that they are supposed to work, and even the contract itself of work. There should be those. So these standards or these laws stipulate how contracts are supposed to be structured. The benefits, the risks, all these should be factored in any contract before you start working. And then we also realize that we have these standards stipulating the safety and health of the workers. So dignity and human rights are interrelated, and they are mutually reinforcing and interdebating. And on one hand, dignity and human rights in a workplace can improve occupational health outcomes by preventing or reducing work-related hazards and risks. So whenever you are putting in place these protective measures for for workers in the workplace, and you factor in dignity and human rights, then you're able to reduce these work-related hazards, risks, and violations. Then occupational health can enhance dignity and human rights. So when you adhere to occupational health regulations, you're able to promote this dignity and human rights. So this will go a long way to promote workers' well-being, dignity, and their participation in all these corrective measures of occupational health. So we acknowledge that dignity and human rights have been violated in workplaces, and here are some of the statistics to put this message clearer. So according to the International Labour Organization estimates, there are about 2.78 million deaths per year due to work-related injuries or diseases, and then 374 million non-fatal injuries that are related to work. Then we also have about 25 million people in forced labor, which is against, of course, their human rights. And then about 152 million children in child labor, which is also against human rights. And then 40% of workers experiencing harassment, which violates their human rights and dignity. And then we have 50% of workers facing discrimination at work. All this affects and violates dignity and human rights of these workers. So how can we address uh, these violations of dignity and human rights? We can adopt and put into practice these international and national instruments. Like we've said, we have at national level that South Sudan Labour Act. We also have those treaties by the UN, which are signed between member states uh, to ensure that workers' well-being and health are protected. And then we also have regulations and guidelines by the International Labour Organization. So by putting into practice all these instruments, we are able to protect the workers' dignity and their human rights. Then we can also develop and implement effective policies that prevent or address work-related hazards. So you might find that you have those instruments, but over time there could be arising challenges or these human rights violations, and for you to put in place another treaty or another regulation by by international organization might take time. So at regional level in a country, you can put in place these programs and policies to protect and address these work-related hazards. Then we also can provide adequate resources, infrastructure, and services to support workers' dignity and human rights in a workplace. So when you look at dignity, for example, in a workplace, if you do not have good sanitary facilities, you know, ladies cannot dispose of their menstrual towels, which are used in a proper way, or both ladies and men share the same sanitary facilities or toilets, there will be compromisation or violation on your dignity. But providing this infrastructure that maybe separate men from ladies whenever they're accessing these sanitary facilities can promote this dignity that we are talking about in the workplace. So for us to promote dignity and human rights, we can take on different approaches. And one of the approaches is regulatory approach, which is based on establishing and enforcing those laws and regulations that we talked about earlier. And it relies on the authority of the state to monitor and inspect workplaces. And if these workplaces are not adhering to those set laws and regulations, these authorities impose sanctions for non-compliance. So they can either suspend operations of such a workplace or even close it down altogether. Then these laws also provide for compensation for the injured and ill workers. So this regulatory approach is majorly more of enforcing these laws that might be in existence or have been developed. Okay, you make sure that they follow these workplaces are following and complying with these laws. So the advantage of the regulatory approach is that it creates that level ground of that level field for employers, and it protects workers' rights to a safe and healthy work environment. So it creates that leveled ground whereby no one is higher than the other. Okay, so these regulatory bodies are able to bring together these people and enforce these regulations so as to protect the workers' rights to a safe and healthy work environment. But the challenge of this approach is that it can be costly and complex to implement since it involves using these regulators. Okay, so they have to be funded, they have to be you have to use these enforcers like police sometimes to close down these organizations. Then it also creates that culture of compliance rather than prevention. So whenever you're going to inspect a workplace and maybe they have not been having personal protective equipment for their workers. Now they can buy them uh, during that short time. They make sure that their employees are using them. Then after this inspection, they stop using those personal protective equipment. Okay, so it creates that culture of compliance rather than prevention, like that culture of preventing these hazards and workplace injuries is not promoted using this regulatory approach, and it can also exclude marginalized workers and those that are not covered by these formal regulations, because these formal regulations that are enforced by this regulatory approach might be covering only nationals. But in a workplace, you can also find migrant workers, those that are coming from outside countries, and yet their health and well-being also needs to be protected. So in this case, that regulatory approach might not protect such workers. Then the other approach that can be used is the participatory one, which is based on the involvement and empowerment of workers and employers in designing and implementing occupational health and safety programs. So here you bring together the workers, the employers, and other stakeholders in a dialogue kind of of, uh, of, of approach, which will include representatives from all the fronts: the workers, the employers, other stakeholders such as unions and NGOs. So they come together, they design and implement occupational health and safety programs to protect workers' health and their well-being. So this participatory approach fosters that culture of prevention, because when they come together, they are able to identify the hazards. You know, the employees or the workers are the ones who know the hazards in a particular workplace. So when they are brought together, when they are brought on board to participate in designing these intervention measures, you're able to promote that culture of prevention rather than just compliance, like we saw in the regulatory approach. And then it increases workers' awareness and ownership of occupational health, because they have participated in designing these measures. Okay, then it enhances trust and cooperation between workers and employers, because they are they have taken part in this designing and implementation of these measures. Okay, so those are the advantages of the participatory approach. And then the disadvantage is that this participatory approach might be time consuming. It might require a lot of resources to bring together all these stakeholders, and then it can create conflict of or power imbalance, because of course there are those inherent power imbalances between the employers and the employees. So if they are not managed well, there can be all those conflicts that will will affect the implementation of this participatory approach. Then it also depends. This participatory approach depends on the willingness and capacity of the workers and employers to participate effectively. Do the workers trust the employers to put in place these measures? Are these employers willing to put in place the measures themselves? So that is the problem with this participatory approach. In the other case of regulatory, we we saw that those regulatory bodies are the ones which enforce these laws. Okay, but in this case, you have to depend on the willingness of his employers and the trust of his workers. Then the last approach in promoting human rights and dignity of workers can be the systems approach, which is based on recognizing and integrating multiple factors that affect occupational health and safety at different levels. So occupational health and safety challenges can arise at individual level, organizational level, sectoral level, national and global level. So this systems approach applies those scientific methods of gathering data, organizing it, analyzing it, and using it to identify the hazards, assess the risks, implement the controls, and evaluate outcomes to improve performance as far as occupational health and safety are concerned. So the advantage is that it provides that holistic view of occupational health. You're able to analyze from individual level to global level. Okay, so it is holistic in nature. Then it enables in identifying and prioritizing key risks and opportunities, and then it supports continuous learning and improvement. The challenge is that it might be complex and technical to implement it, and sometimes the technical know-how is always lacking in some settings. Then it requires a high level of coordination between all those sectors, between all those levels of this system that we have talked about. Then it can also face resistance from those people who are conservative or who prefer those traditional and straightforward approaches like the participatory and the regulatory approach. So we realize that for us to have good occupational health systems, we need to benchmark from other places which have put in place good occupational health systems. For example, in Germany, there is that robust regulatory approach whereby there is high level of, of participation from workers' councils, and it also has a well-developed social insurance. So that is what is in Germany. But in Brazil, we have a mixed participatory and regulatory approach. So there is participation, but also regulations come in. So it has a vital role of labor inspectors who, of course, will put in place this regulatory approach, and then a network of specialized uh, occupational health services. Okay, so these all take part in enforcing this regulatory approach. But like we said, it is a mixed regulatory participatory approach, so it has that low level of participation from informal workers who sometimes, by the way, are ignored in most settings. Those informal workers, like we are going to see, sometimes are ignored, but in Brazil, their rights and dignity is taken care of. So it also needs more resources from occupational health services. So the best practice in making sure that dignity and human rights are observed in workplaces is to adopt a risk-based approach to occupational health and safety. And this means that we have to focus on the most significant hazards and risks, and implement the most effective and feasible controls to prevent or reduce them. So this can be done, of course, by either allowing uh, participation from the workers or the employees in designing these occupational health strategies, but also it can include use of scientific methods, gather data, organize it very well, analyze it very well, and use this information that you have got from this data to put in place these effective and feasible controls to prevent and reduce these occupational hazards. And when you do so, you're able to improve efficiency and effectiveness, and also reduce the costs and waste. Because when you don't follow anything, you have not involved the workers who know these occupational hazards that exist, you have not used the data, you're going to put in an intervention which is not focused. It is not going to be effective and efficient, and this can lead to a lot of costs and wastes. Okay, it can lead to waste of your resources, your time, and everything that can be lost. And you don't want that as an organization, as an industry, or any workplace. Your money you should be having value for your money. So that is why you need to make sure that you use this risk-based approach. Analyze, assess for the risks, and put in place measures to focus on those risks that have been identified and then alleviate them. So this practice, or this best practice, has been observed to be used by small and medium enterprises in the United Kingdom. Then the other best practice is to promote worker participation in occupational health and safety. And this means that you involve them in identifying the hazards and risks. Like we said, they're the ones on the ground, they're the ones working in that workplace, they are the ones who might identify correctly the hazards and risks. Give them the right information and enable them and empower them to identify these hazards and risks. So it will mean that you consult these workers in designing and implementing controls and programs, and this will enhance occupational health practices by increasing the workers' awareness and ownership of such programs and interventions. So when they own and are responsible for these interventions, then your intervention will be sustainable. Okay, we're not going to put in PPE and all these personal protective equipment and they stop using them. But if they are the ones who have identified that they need them, then your intervention will be sustainable. And this will also improve the trust and cooperation between workers and employers, because these workers feel that their voices are being heard, they're important in this organization because they are allowed to participate in formulating these intervention measures. So this best practice is observed in the establishment of joint health and safety communities in Canada. So for us to apply these lessons that have been learned from different situations, we have to use a proactive approach about workplace occupational health and safety issues. And this proactive approach, like we said in our last session on safe workplaces, we do not have to wait for these hazards to strike. We do not have to wait for disaster to strike in the workplace, but we have to put in preventive measures to mitigate such workplace hazards from occurring. So this means that we report hazards and incidents promptly or in time, and also means that we seek information and training on occupational health and safety rights and responsibilities. Then this will enhance occupational health practices by improving and preventing the detection of these occupational health problems, and it can also empower workers to demand for better working conditions if they have the right information. So, like we say, there are those vulnerable groups who might be disproportionately affected by these occupational health hazards, and they are more susceptible to getting ill, injured, or dying because of these hazards. So they include migrant workers, those who could be coming from outside countries and maybe are not protected by native laws in that country where they have gone. And then informal workers, those who might be in the informal sector, either they are self-employed, these casual laborers, and then women workers sometimes face these hazards like sexual harassment by their male bosses. Okay, so one group that we talked about being vulnerable is the informal workers, and these, like we said, are often not covered by these formal contracts. There are no contracts between them and their employers. The laws sometimes do not factor in these informal workers. The regulations also uh, do not cover their rights. So this group includes, like stated earlier, those self-employed workers, home-based workers, those that we are, those house helps, or the street vendors. So these informal workers are more exposed or susceptible to occupational health hazards and risks because they often work in unregulated, unstable, and unsafe environments such as factories, mines, or markets. And they lack social protection in terms of insurance, such as that insurance, like I've said, compensation and benefits that can mitigate consequences of work-related injuries or illnesses. So that is why they are always vulnerable, because when they get these illnesses and injuries, there is no protection for them. Then the other group is migrant workers who are more exposed and susceptible to these occupational health hazards because they often work in those low skilled, low paid, and hazardous jobs, such as in construction, in agriculture, in mining, and domestic work. And they face barriers such as language. Sometimes you migrate to another country where you do not know or you can't speak or understand their language. Then the culture sometimes is also a barrier. The legal status, sometimes these migrant workers are not allowed to access hospitals or public hospitals in the countries that they go to, and this limits their access to information, the services like healthcare, and then rights that are related to occupational health. Even when they are injured, they cannot run anywhere because legally they are not maybe allowed in that country where they are. So protecting these vulnerable groups will require us to provide culturally sensitive and appropriate education that is linguistically sensitive, like we've said, because they have those barriers in languages. So we should provide this education and information and training, taking into consideration of their different cultures and their languages. So this information should be culturally sensitive. It should be in the language that they can understand. And this information is on the occupational health and the safety issues. Okay. Then we should also extend formal regulations and social protection schemes to cover these informal workers. These informal workers should also have a kind of protection in those social protection schemes. Okay, if there is an insurance scheme that protects workers in the country, it should also take into consideration of these informal workers so that whenever they face a challenge in their workplace, whenever they are ill or injured, they can always either be compensated or access medical attention. So the lessons that are learned from all this is that for us to effectively put in place these intervention measures of occupational health to protect and promote the health of workers in the workplace, we need to use a systems approach to occupational health and safety management. So this will mean that we integrate occupational health and safety into core business processes and strategies from the word go, from the designing and planning of any business, any organization, or any industry. You should integrate this occupational health and safety in those processes. So it also means that regulatory. We should also do regular monitoring and evaluation of occupational health and safety performance, because we realize that in some cases, some employers might be adamant or stubborn to put in place or implement these occupational and safety standards. So you need to regularly monitor and evaluate whether they are in place, which gaps need to be filled, and how can you fill them. So this will enhance occupational health practices by improving the quality and productivity, and it will also reduce the liability and improve the reputation of organizations. So you can realize that if you improve occupational health in your workplace, then your reputation goes up. But if it is your occupational health is poor, then there will always be those reputational risks, or the risk of your organization losing the respect that it deserves. So this brings us to the end of part two of this session on ethical and legal issues in occupational health, where we majorly focused on dignity and human rights, and we looked at those examples of how people are doing it in other countries, and how we can learn from them, and then also saw the approaches that can be put in place to effectively take care of the human rights and dignity of workers in different workplaces. So thank you so much for joining me in this part two of this session, and I shall see you in the next session. Have a nice day.